So to recap, the stuff that you'll need for diapering and pottying are probably some disposable diapers, some cloth diaper insides and outsides if you're using cloth, a diaper pail, some diaper creams, and then some potty training supplies, especially a potty seat adapter. That's one of my faves. Hi, you're listening to Season 4 of the Baby Manual podcast, the podcast that helps new parents all over the world navigate the everyday challenges that arise when you have a young baby. This season will help you decide which pregnancy, baby, and toddler items you actually need and which ones are a waste of time and money. I'm pulling on the knowledge of hundreds of thousands of new parents around the world, other pediatricians, doctor moms, the Academy of Pediatrics, breaking pediatrics news sites, all to give you the best information and recommendations that I can because I know how overwhelming it can be. I'm your host, a pediatrician, a mom, and an author, Dr. Carole Keim. Hello, welcome to this week's episode of the Baby Manual podcast. We're going to be talking all about diapering and potty training, which is something I'm really passionate about because, oh man, in America, we potty train very late compared to the rest of the world, and we go through so many diapers. And gosh, it just feels really hard on the earth to me. So let's talk a little bit about the different options for diapering and for potty training. So for diapering, now, a lot of us will start off with disposable diapers, and I do recommend having some disposable ones on hand when your baby is very young. So for the first week of life, they're having about one poop and pee for about however many days of age they are or more. So we want to have at least one pee and poop on that first day, at least two on that second day, and so on. And then around a week of age, they start peeing and pooping every time that they eat, which is typically 8 to 12 times per 24 hours. So you're going to go through a lot of diapers starting around a week of age. Diapers are one of those things that at baby showers, a lot of people like to bring because they know that you're going to use them. And you can go through quite a few. And at the very beginning, when your baby is very young and waking up multiple times a night to eat, it can be really hard to give yourself any extra work. And so disposable diapers are very convenient during that period of time. So the newborn size ones are the typical ones that you would want. There's a lot of different brands of diapers. My personal favorite is actually Pampers because I just feel like I see less rashes with those. They have less of the smells that other ones have. Most diapers do have some scent to them to help mask the smell of pee and poop so that they don't just smell bad all the time. But if you want to go with one that's unscented, there are a lot of really good companies like Honest Diapers that have just an unscented, and organic and all that. They do tend to be more expensive though. The other thing I really like about Pampers is that they have a strip on the outside that's yellow and it turns blue when it gets pee on it. And it only reacts to pee. It doesn't react to just being wet. So if your baby poops, it's not going to turn blue. And if you, say if it's just wet from, water or whatever, that doesn't make the strip change color. It only changes color from pee. So that's really nice because then you can just take a look at the outside of the diaper and you'll know if your baby has peed or not. And it also makes it really easy at the beginning to count the number of times your baby pees per 24 hours because you do need to be tracking that for the first couple of weeks just because your pediatrician's going to ask you at the appointments, how many times are they peeing and pooping? And that's a good indication of how much your baby is eating. I like water wipes in terms of wipes or even just a washcloth with water, but you're going to probably use one for each time that your baby poops and sometimes more than one, but when they're real little and the first couple of poops are meconium, you might need a couple because those tend to be really sticky. The meconium poop, it sort of looks like silicone caulk and it sticks in that same sort of way. There's not really much that's that consistency, but when you go to wipe it, it just kind of spreads a bit for the first couple wipes and then it'll eventually come off. Once your baby starts having transitional stools between the meconium and regular poops, then they get softer and softer and easier to wipe up. And then around the time that your milk fully comes in, or even for like formula-fed babies, it's around day 3 to 5, then the poop starts to transition further into eventually becoming a yellow seedy poop, which kind of looks like cottage cheese with mustard mixed into it or turmeric. It's yellow with these little white pieces in it. And that is a normal baby poop. So those are very easy to wipe. And again, you just like 1 or 2 wipes each time with that. In terms of diaper pails, there's a few different options for diaper pails. And the top 2, I would say, if you're doing disposable diapers, the Diaper Genie is really good. What that does is it has this long roll of a plastic garbage bag that goes inside of it. And each time you put a diaper in, it like twists closed. And that kind of seals off that diaper in a little twist. And so the Diaper Genie has the least smell, I would say, for the disposable diapers because of that twist feature. And when you take the diapers out, it's kind of like a roll of sausages, like a long link of sausages. Each diaper is wound in there. So that helps a lot. But really, any trash can is fine as long as you empty it often enough. For cloth diapers, we'll get there in a second. I like a different diaper pail. Things that you don't need for diapering, you don't need a wipe warmer. And what I've seen actually lately is that wipe warmers can even cause mold to grow on the wipes. And so, it's not a great idea. I mean, whether the wipes are warm or not, by the time you get it out of the warmer and onto your baby's bottom, it's still going to be wet and it's still going to be a little bit cold. So it doesn't really make it any more comfortable for them. If you're worried about the temperature of it, you can always just pull a wipe out at room temperature and hold it between your hands for a second before you use it, and that'll warm it up for a second. But you really don't need that. And another cute thing that I see a lot of people get at baby showers, but isn't really necessary, is a PPTP, which is just a little cover for baby boys that goes over their penis so that they don't pee on you during the diaper change. Just a heads up, boys and girls both pee during diaper changes very often and poop during diaper changes too. So what I would usually suggest is just to have a washcloth nearby or burp cloth, something that you can put over them if it's coming out quickly. Or if you look in my book, The Baby Manual, I have a diagram of this diaper trick, which is where you put the next diaper underneath your baby before opening the first one. And so if they do start peeing and pooping when that diaper is taken off, it just goes right onto the next diaper. Also, when you first go to open your baby's diaper, I say every time, open it loosen the sides and open it a little bit and see if they're peeing and pooping. And if they are, just hold it closed with your hand, flop it back into place. Wait a few more seconds, check if they're done, and then once they're done, then you can go ahead and change them. So you don't need any special devices to catch the pee and poop. A washcloth works or the diaper itself works. For cloth diapering, one thing I love about cloth diapering is that it is easier on the environment, and there are some really good cloth diapering services. I don't know if they're available everywhere, but if you can find one, the way that those work is you just collect all of the dirty diapers for a week in a diaper pail. And then on whatever day of the week you have your service, you just leave the bag of dirty diapers out in front of your house. And then they drop off, they pick it up and they drop off a clean bag of the diaper insides for you to use. And then they take those to their facility and wash them for you. It's extremely convenient if that's an option in your area. I highly recommend that. If you're washing your own cloth diapers, one thing to be aware of is that you can't use fabric softener because softener will make the diapers water resistant, which kind of defeats the purpose of having a diaper on. So, and you also, with cloth diapers, you can't use anything petroleum based because those also will coat the diaper and make it waterproof. So you don't want those. You need a cream that would work so that the diaper will maintain its integrity. I'll get to creams in just a second. So the way that cloth diapers work, there's an outside part and an inside part. The outside part is the cute part that has the snaps on it now, and you put the inside, which is technically the diaper, in that. And so those inside diaper parts are typically layers of cotton that are sewn together or bamboo, and a lot of them are trifold, where like the middle section is thick fabric and the two sides are thinner fabric, and you fold it into thirds and then put that on the inside of the diaper. There are a lot of different options for the cloth diaper outsides, but a lot of them are essentially very similar, where they have multiple rows of snaps. It can be really intimidating to look at first, but once you realize like the lower snaps are for the size of the diaper. So you just have one row of snaps that's going to be always closed. And then the higher row of snaps that goes along the waistline is for the tightness of the diaper. And so you can snap the two sides onto whichever of those snaps is the right side. And those are really nice because they grow with your baby. You might need to get a size small and size medium of diapers because when the babies are very young for the first 1 to 3 months, those regular cloth diapers can be really, really bulky. And you might need to size up in clothing, or at least in pants size, if you're having those really bulky cloth diapers on. The best diaper pail that I found for cloth diapering is the Ubi diaper pail. I'll put a link for that one. And what I love about that one is you just put a bag on the inside. There's like a little arm that holds the bag for you. And then you close the top and there's a sliding part that slides open to put the diaper in. And when you slide it closed, it seals and it doesn't smell. It smells inside, of course, but it doesn't make the room smell, which is really nice. And also there's a lock on the top, which it's really just like a latch, like a catch that you can turn to the lock position so that when you have a toddler in the house, they don't go and just start opening and closing the diaper pail and reaching in like they like to do. So that lock is really handy. Yes. So I love the Ubi diaper pails. Things that you don't necessarily need for cloth diapering are the petroleum-based ointments, which I usually recommend for regular disposable diapers because they tend to be the best at fighting diaper rashes. But for cloth diapering, remember, petroleum is the enemy. So for diaper creams, starting off with those petroleum ones, Vaseline and Aquaphor are my two basic recommendations for just about every normal diaper rash and also to prevent diaper rash. What I like about those is that they form a barrier. And so when your baby pees and poops the next time, it doesn't get onto their skin. The way that diaper rashes happen is from friction and moisture. And so it can happen at any time. And most babies will at some point have a diaper rash. So don't feel bad if it happens to your baby. It's a very normal and common thing to happen. If you use wipes after your baby poops, I would suggest putting on a thin layer of diaper cream after that, and that can really help to prevent diaper rashes. There's also A&D ointment, which is petroleum-based, and it has vitamins A and D in it, and those are things that help to heal skin as well. That one has a pretty strong smell to it, and so it's one that I sort of think of it as a slightly medicated ointment versus the Vaseline and Aquaphor. Vaseline is just regular petroleum, like white petroleum, and Aquaphor is petroleum that also has lanolin in it, so it's a little more moisturizing and healing. But some babies can be allergic to Aquaphor, and some babies are allergic to A&D ointment. So the basic white petroleum or Vaseline is a really good option for if you have sensitive skin or if anyone in your family has allergies, asthma, or eczema. Those are risk factors that your baby might have an allergy to something topical like that. So the plain old Vaseline is great. The zinc oxide-based ointments are the next most common type of ointments that people use. Those are the white ones. So zinc oxide is like a white powder. So the diaper cream itself is white, and it can get on all kinds of things. It can make a mess when you're using it, so just be careful to keep it just on their booty. The most common brand here in the US is Desitin for that one. And I would go with the regular Desitin. I find that the extra strength one, for whatever reason, seems to cause more rashes. And also, if your baby is tending to get a lot of diaper rashes, it could just be an irritation from the cream that you're using. It could be the brand of diapers. You could try changing brands of diapers. But also for regular irritant diaper rash, if you just switch off between a petroleum and a zinc oxide one, that's a really good way to treat that. It should be treated within 2 or 3 diaper changes. If your baby has a diaper rash that's lasting longer than that, you might want to go with some medicated creams. But just quick, before we get to those, calendula cream and other ones calendula is made from marigolds, and it's a natural anti-inflammatory. A lot of those are beeswax based as well. And those can be really helpful for when you're cloth diapering instead of a petroleum-based one. But you can also use zinc oxide creams with cloth diapers. So the calendula creams I'm listing them third just because they are less effective than the petroleum-based ones for everyday use, but they can be helpful. Also, another thing that can help with diaper rashes is to try to let it dry out because, like I said, moisture and friction are the two things that cause diaper rash. So after diaper changes, as your baby gets older, when they're not peeing and pooping with every time that they eat, you can try just leaving the diaper off for a little bit of time or leaving it open until, if you use a wipe, like leave the diaper open until their skin has dried off and then close it up. So if your baby's diaper rash is not healing after like 2 to 3 diaper changes or getting worse, or if it's been a couple of days, like if it's getting a little bit better and then it gets worse again, those are all reasons to think that it might be colonized with something. And that's also very, very common because we have yeast that lives on our skin and bacteria that lives on our skin normally. That's a normal thing. So when the diaper rash starts to happen and the skin gets broken down, sometimes the yeast or the bacteria can get in there and cause a little bit of an infection, and that will make the regular diaper creams just not really work. So for those, I suggest having some on hand that you can buy over the counter, but really the best treatment for those are going to be prescription creams. Ones that you should have on hand before your baby is born are clotrimazole or miconazole or terbinafine. Those are all antifungal creams. They're sold over the counter in the US either by that name or by brand names, or they are sold by what they do, and they're called things like jock itch cream or athlete's foot cream or ringworm cream. Ringworm is actually a fungal infection of the skin. So all of those creams are safe to use in the diaper area. They should never go inside the vagina for baby girls, only on the outside, but those are all safe to use on skin in the diaper area. And those can help with the fungal ones. And the reason to think that your baby's diaper rash is colonized with the yeast or fungus is, which is the same thing, by the way, is you'll see an area of rash, and then around it, you'll see these tiny little dots that are called satellite lesions. And so when outside the edges of it, you see all these little dots of rash, that's a reason to think it's a yeast or fungal infection, and one of those antifungal creams should help. You can also use apple cider vinegar mixed 1-to-1 with water, or white vinegar. Those again, mixed 1-to-1 with water, and dab that on 3 times a day, or use the antifungal cream 3 times a day. Vinegar is a natural antifungal. And actually, if you go back to the 3rd season of Baby Manual podcast, there's an episode where I talk a lot about other different natural antifungal things that you can do. The prescription antifungal that we use for diaper rashes is nystatin. And that one also is a very safe antifungal medication for babies, and just locally acting, and can be given topically. It can apply topically 3 times per day. And that's just one that you would need to ask your doctor for a prescription for. When your baby has a yeast diaper rash, you want to also use regular diaper cream in between the times that you're doing the antifungal cream, because that's only going to be 3 times per day, and your baby's probably going to be using their diaper a lot more than 3 times per day. So all of the other diaper changes, you should use one of those first 2 ointments that I mentioned, either a petroleum-based or a zinc oxide-based. The antibacterial ointments. So bacterial colonization in the diaper area looks like pimples, like individual boils or pimples in the skin that are typically red around the edge, and then you might see a head in the middle of it that's white or yellowish in color. And typically there's just like 1 or a few of those. It's not generally involving like the whole diaper rash area. So you might just see like 1 or 2 of those in there. And you can use something over the counter like bacitracin or neosporin. Those are antibacterial ointments that you can put onto there also 3 times per day. But the best one is the prescription strength one, which is mupirocin ointment. And your doctor could prescribe that if there are boils in the area that are recurrent. Mupirocin will treat MRSA, which is the type of staph that is resistant to most antibiotics. And so that can be really helpful for if your baby's having like multiple occurrences of boils in their diaper area. Also, when you're treating your baby for something like that with mupirocin ointment, because it's happening multiple times, you also should treat anybody who changes the baby's diaper with that same ointment under their nails 3 times per day and inside the nose, because that's where it likes to live. So so for any caregivers in the house, you can use that same tube of ointment that you're putting on your baby's bottom. Just put a tiny bit under each of your nails and inside of your nose every time that you change that baby's diaper. Probably a good idea to change them, use the ointment, wash your hands, and then apply it to yourself if you're able to, just to make it less likely to recur. Another thing I really like for diaper creams, but that is not really necessary, is a diaper cream spatula. And I ended up using that with both of my children just because I have decently short nails, but I still get diaper cream under the nails every time I apply it. So I liked having that spatula because then it just doesn't get on your fingers. And you can just wipe that off with a wipe afterwards. You don't have to wash it every time. You can just wipe it off. And it's real easy to apply to the baby's skin. And it also helps it to spread around really nicely. And so I'll link that, the silicone diaper cream spatula that I like for that. For potty training, okay, so I do have an earlier episode about potty training and elimination communication and early potty training or potty training from birth or diaper-free method. It has a lot of names. I like the name elimination communication because really at any age, teaching a baby to use the potty is a communication between the baby and you. The parent has to know when the baby's about to go potty, and the baby signals that somehow. And then the parent has to signal back to the baby that they're going to be taken to the potty to be able to go. So you can listen to that earlier episode about how to do it exactly. But things that are really helpful for potty training and for early elimination communication are a potty chair for each room. So one that sits on the floor that you can dump into the toilet after they go on it. Those are nice because typically your baby can sit on it with their feet touching the floor, and so they feel really stable on it. The downside with that is that you do have to wash it out each time you use it. So it's a little bit of extra work to then dump that into the toilet and then wash it out. What I ended up using with my children was just a potty seat adapter, and I found that to be a lot easier. And I'll link the one that I like. There's a lot of different options for these, but the ones that are completely flat are only really good for toddlers, for preschool age children. They're not great for babies. The ones that are a little bit shaped, like that one that I'll link for you, those can help to hold the baby in place a little bit easier so that they don't tip side to side or front to back. And they're a little more stable on there. And so it's a lot easier when your baby is little and you're doing that. So yeah, I would say you can start as early as the time that they start having the discoordinate stooling, which is typically around 6 weeks of age. So anytime after that, up until that point, babies are peeing and pooping with every diaper change. And then after that, they're only pooping a few times per day and typically pee every time that they eat. So while there is a whole episode about this and also a section in my book, The Baby Manual, about this, I'll just tell you real quick. With elimination communication, the easy catches, the easy way to start with it is to put the baby onto the potty every time they are done eating. So you use your potty phrase, something like, let's go potty, and then you bring them there and put them on the potty after they've eaten. If you have a baby that immediately pees and poops every time you open their diaper, that's a really easy catch. You can just open their diaper in the bathroom over the toilet and use the phrase and put them on the potty. And that can be a really easy way to catch it. And then the other really easy catch is when they wake up. So waking up from naps, waking up in the morning, those are times when babies usually have to potty as well. So those 3 easy catches are a good way to start. For bigger kids who are potty training, you might want to get a step stool so that they can get up onto the toilet and use that potty seat adapter. And they even make ones that are a potty adapter plus step stool in one. So I really like those ones if you have a toddler and you're starting and you want to wait until toddlerhood to potty train. So I can link that one for you. When your baby is doing well with the pottying and starting to not need diapers all the time, which my sort of unofficial checkpoint for my kids was if I open their diaper and it's dry and they go on the potty and I put that same dry diaper back on and I've put it on 3 times, I think, okay, maybe they're ready to start transitioning into underwear. The thing is, a lot of underwear, especially the padded underwear for babies that are potty training, are pretty big. They start usually size 3T from what I've seen. So to find smaller underwear than that, there's this great website called Tiny Undies, and we'll link that too. And they have as small as 6-month size. So that's really great because, when you have just these big baggy underwear, that's not going to be very helpful for babies doing elimination communication. So again, more info on all of this in my book and also in previous episodes of this podcast. Things that you don't necessarily need for potty training. You don't need a floor potty that sits in the bathroom. I said have one for each room. And what I mean for that is rooms that you're hanging out in, because if your baby has to go urgently and it's going to take too long to get them to the bathroom, then you may just want one, say like in the living room, in the kitchen, whatever. But if you're in the bathroom already, you might as well just use a potty seat adapter and have them go straight into the toilet. I feel like that's a lot easier. If you're starting later with the potty training, like age 2 to 4, like we usually do in the US, is when typically we start with potty training, then sometimes it is nice to have one in the bathroom because then they can go at the same time as you and learn from seeing the adult use the potty. And also just a quick reminder, with baby boys, when you're doing potty training, you want to start with them sitting on the toilet. They'll learn to stand eventually. You don't need to ever teach them that. They can figure it out on their own. And when baby boys start standing to pee, a lot of times we'll start with holding poop at the same time and they can become constipated and it can be a problem. So having them sit on the potty every time while you're teaching them is the best advice I can give you. And then sticker charts are fairly commonly suggested for potty training. I don't love them. Unless your kid loves stickers and the sticker itself is a reward, then maybe. But for the most part, some delayed gratification for doing something that is natural anyway. I mean, babies don't want to sit in their own waste. So it feels good to use a potty. It feels good to get that stuff out of your body and not have to sit in it. That alone is enough of a reward for most children. If you're starting very late, like after age 4, then maybe a sticker chart might be helpful. When you're doing things like that and giving rewards for pottying, again, it can backfire. It can cause too much pressure on the child because they want that reward. That's also why we usually don't recommend giving food as rewards for potty training, because it can be really stressful for the child, because the only way they can get that special food treat is by pottying in the potty. So that extra pressure can make it harder for them to go, because, it's really hard to pee and poop when you're nervous. So, and then also make sure that you never, ever punish your child for accidents. If they pee or poop in their pants or in their diaper while you're training, they're not doing it maliciously. It's not intentional. It's an accident. So make sure that you don't ever punish your child for that. All right. I hope this was all really helpful for diapering and potty training. I hope I've inspired some of you to potty train early and also to maybe consider cloth diapering, because really it is so much better on the environment. And also, one great thing about cloth diapering with early potty training is that the cloth diapers stay wet and they feel more wet than the disposable ones do when they pee. So like with disposables, the pee tends to soak in and it wicks away, which is nice for preventing rashes, but not as conducive to potty training, because then there's less motivation, I guess, to not be sitting in a wet diaper. Whereas with the cloth diapers, they get cold when they get wet, and so the child can feel it right away. So those can be really helpful to do together. Awesome. So next time, we're going to be talking about stuff that you should bring when you're out and about, travel stuff, portable stuff, what to put in a diaper bag, all that kind of stuff. Thanks for joining me. Have a great day. So to recap, the stuff that you'll need for diapering and pottying are probably some disposable diapers, some cloth diaper insides and outsides if you're using cloth, a diaper pail, some diaper creams, and then some potty training supplies, especially a potty seat adapter. That's one of my faves. Thanks for listening. Remember, all of the links from this episode are in the show notes, and you can always go to my link tree, which is linktr.ee/drkeim. If you know anybody who is pregnant or has a little baby, tell them about this show. Maybe they would like to listen to this podcast. They might find something helpful in here. And if you know any friends who are pregnant and want to get them something for their baby shower, I would definitely recommend my book, The Baby Manual. It's meant to be all-inclusive. Really, all the questions that arise in the first year of your baby's life are in that book. So Baby Manual is also linked in the show notes and on my link tree. Have a wonderful day.